So how did it start for you with the magnetic mallet?
Magnetic Mallet, for me, I was always, a tech savvy person. I always wanted to ensure that I adopt practices which minimize trauma to my patients. And uh, and one thing and when I started learning implants, it was a lot about harvesting bone during the drills. So we bought a lot of suctions that could harvest bone that was getting wasted during the surgery, and harvesting bone from the drills and then giving that bone back to the patient. And I felt it's a very cumbersome process, first to take out bone from the patient, then filter it out and clean it and give it back to the patient. So my radio with mallet started in 2013. I saw the extractor in 2013 as
2013,
30. I saw the
12 years ago.
12 years ago. I saw the extractor, and then most of the conferences we are going, there are a lot of buzz around mallet, but somehow the sound, and when we tried it, because they didn't have a demonstrable model, so all the time, like we were going to the booth, coming back and thinking about it, then we didn't have enough information.
Hmm. So you were just hovering on the magnetic mallet and
No. And then when I finally decided that enough is enough, there is a technology which is a zero bone loss technology, very beneficial for our patients. So that's the time I decided to take the plunge. And I still feel that that's the best thing I ever invested, because I was an ultrasonic guy before.
okay, that's really you were
Brand
coming.
ambassador representing ultrasonics. And
But tell me, your first procedure with the magnetic mallet. What was the feeling? What was the feeling for the patient? Uh, how did it happen?
more than patient, I was anxious, to be honest. Because I was anxious, because again the sound was one part that was very like disconcerting, that how will patient react to the sound. And I told the patient that it has a click to it, and please listen to this click. Do you find it offending or uncomfortable? The patient was braver than me. He said, "Go ahead, doctor. We totally trusted."
Okay.
And when I did my first case, that was one of the most awesome experience, because that is implantology really right. You know, when you are using drills, your vision is obscured by a big handpiece. You have a lot of water coming in. Your assistant is extremely busy taking out that water from the patient's mouth, and the flap retraction is not good. Now, the game changer is my assistant is only bothered about retracting a good flap. He makes my visibility 10 times better. There is no water, so patient is very, very comfortable during the procedure. There is very less bleeding because you're compacting the bone, so there is no bleeding.
Yeah.
So the experience was overwhelming. It was like when I slept at night, I could replay the surgery, and I was thinking like, why was I hovering around this technology for so long? It is such a beautiful technology. And I was very concerned about the patient also. So next day morning, first thing I call up the patient, I ask, it, how are you doing? He said, no pain, no swelling, and I'm absolutely comfortable. I be feel a thing.
Okay.
And do I have to have painkillers? I'm not having pain. So the technology. So I was totally blown over. The first experience was the most mind-blowing experience. And since then, I always make sure all the associates who work with me experience the mallet versus, it's like a kid to me now to show people that mallet versus drill, and for the first time user,
Okay.
and the first time user will always choose a mallet over a drill. There's no doubt about
The wow factor is always
the wow factor, the ease, the convenience, the accuracy, the control. Suppose you have compacted bone in the wrong direction. You said, okay, I have become a little busy. So you have actually not lost bone from the site. You have compacted. So you go little distant and you go in a different direction. So you're not, you can again compact bone on the mesial side while you go making the osteotomy distant.
that is really a game changer.
And imagine cases where all in four, you're putting distal implant, which is tilted.
Yeah.
To put it with a drill, with the excess opening which is required to put a distal implant in the region of 6 is huge. With the mallet, it's like you can sing the song while putting a distal implant, and you can be so accurate. So it's a game changer.
We need to tell everyone about it.
Oh, in my personal capacity, I keep praising it. A lot of people get influenced about the mallet, and I think it needs its rightful place. Is because it's not only implantology; it's like basic extractions. A lot of people don't
Yeah,
understand.
that is what I wanted to. I wanted to touch base on these extractions. Okay, everywhere we go around the world, mm, we go there. Okay, we have this technology. You can do this. You can do that. Bone management, a lot of things, and the extractions. So typically, the first reaction I get is, I'm good with the way I do extractions.
No,
Right?
say after using a mallet.
Can you say this loud? Because
See, I tell you what. I'll tell you a very small thing. If you Google my name and you look about reviews about me, 90% reviews about me in last 3 years after started using mallet are about extractions. Can you beat it? And we get a 5-star rating about extractions. People have written that this is hand of God. So it's not my hand, it's the mallet behind that sectioning thing. Second, extractions, people are, how to say, I think they're overconfident.
okay.
And in extractions, is one thing is there that you should not be over confident. I went through a very bad road accident and I fractured my right hand. So I lost some power in my right hand. So I asked the orthopedic surgeon, how will I do extractions now? He said, till now you use force. From now you start using your brain.
Yeah.
And that's what mallet gave me. It gave me the brains behind extraction. So extractions are so easy, and I now prefer to section and take out and preserve the bone as much as possible, because once you start using mallet, I think the extractions become extremely easy. They're gentle procedures now. The patient fears extraction, and I've taken out the fear out of the extraction part of it. So patients absolutely love me and they recommend me. Anybody who's going for an extraction, they recommend me, please go this place. He's too good with the extractions.
And that's what keeps your clinic very busy. The word of mouth. And how do you think your implantology or your approach to implantology changed or improved from the day you started to look at the bone in a different way? Like I, I don't have just the drills. I have other options. So with the magnetic
See,
mallet.
to be honest, my approach to implantology changed from a company driven mindset of using a sequential drill system
Yeah.
and making a set osteotomy, and my concepts of placing implants. And with immediacy coming now more and more, we know that osteotomy has to be an under osteotomy.
Okay.
And as the implants are becoming more active at the tip, they want to engage more. So now you are not losing bone. First, you are converting a D3 bone or a D4 bone in a D2 or a D3. So you are getting better primary stabilities. Posterior maxilla was no fun for me before. Now it's a lot of fun. Sinus lifts have become so easy, so predictable. As we were talking before, my last 2 years about sinuses, I've got the most beautiful results,
Hmm.
because, and you're not heating the bone, you're not killing the cells, and you are releasing bone morphogenic protein and the factors required for kicking start the healing. And the poor bone qualities are easier to deal with. So, and the safety, built-in safety. And the best part is the, I think mallet, it has to be emphasized. It's not uncontrolled force. It's so controlled and so precise and so short. And you move a millimeter every.
That is.
So what better you can do that you move just a millimeter every time.
Yeah, that is something that I believe you can understand only when you try it, because you need to feel it, you need to see it. That is what makes the difference.
I make sure that whoever is there are a lot of doctors who come and visit our practice. We apply
Uh-huh.
a lot of implants, and I make sure that I demonstrate the mallet to them. And the curiosity just goes overboard, because uh, the you have the everything is contrangled posterior. You're working in 7. There's so many times I've become so quick, Claudio. Like people doubt that whether I placed the implant or not. So I have to take an X-ray to show I finished the procedure. So they say it was that quick, you see. So my working, to be honest, is under 10 minutes for a single implanted posterior maxilla. So I'm too quick with the mallet now. And it's just, I would say it's like integrated my third arm in the case.
And that is no better. What is the classic case that when you look at X-ray, you say this is magnetic mallet. Anything else is overtreatment, and then that's the magnetic mallet.
Okay. So
But I'm asking this to suggest to the other colleagues here in India that want to try the technology, how would you suggest them to pick a case to try out the technology?
see, I'll to be honest, for me, every case is a mallet case. Every extraction case is a mallet case. Every implant case is a mallet case. But I would say that I let me go back, and there I used to specifically say, "Oh, give me the mallet when I am having a very poor bone quality in maxilla,
Okay.
and I don't have enough volume, I don't have enough height, and I'm scared. I was scared, I might perforate while doing a sinus lift. That used to be initially my love was okay. Maxilla means I go towards gravitate towards a mallet more
Okay.
than a drill. And I would say now after using it for so many years and so many times, I think my gravitation towards when I see a case which is deficient of both, that is my first go-to place is a mallet. And when I'm more bothered about safety, uh, if I'm near some even I use, so to be honest, I use mallet even for uh, sometimes in mandible, but in a very different way. Suppose I did an osteotomy
Okay.
and implant is stuck crustally,
Uh-huh.
it's not sinking in. So either I have to reverse it or and redo the osteotomy and put the implant back. To be honest, I become so lazy. I take a mallet and tuck tuck and push it down.
And you finish the case.
I tap it on the cover screw and take it down. So there are so many things, but I think nowadays I'm doing a lot of pterygoids and more palatally positioned implants, and you have to be the another great point about mallet is damn precise. So you use ligament drill on anything. Whenever you have to put force with your hand, you will lose the directionality of the osteotomy all the time.
Yeah.
But with the mallet, actually you're not pushing, you're just thinking about the direction. And rest of the things the mallet is going to take care. So your directionality is very important. So many times I'm tapping through the guides, uh, trying to make sure that even the deviation that happens in the guided systems, I overcome that. So it gives the first path uh, of least resistance.
Yeah, you realize that you just said something that really makes implantologist's life much easier. I like to say it's a new gold standard. I mean, that's a new way to conceive and approach implantology. Eh, what's the best way to start with? Just start. Right.
I thought the best no this the best way to start is to just start, but I need you that again you need little bit of favor. But you need little bit of time to start the it's not but it's not rocket science. And much more easier to I easier to learn how to, much more easier to learn how to drill a bow and a compact cup. Using a drill also like using a drill power drill and using a mallet and a nail. I like that, which is easier. Mallet and a nail is easier to so I guess is the is
I like that because yeah, it's
very important.
you just say it's not rocket science. This is a tool that makes things easier. Okay, that makes sense because a lot of the things that I see doing with the magnetic mallet for by first users, okay, are things that they wouldn't have done if they didn't have it. So everything they used to do, then these things become workarounds, right? So you used to work with workarounds. Now you just go straight with the mallet to what you want to do because it's easier. Because that's what the technology allows to do.
Yeah, that is so flexible that we have started modifying our instruments. What you have sold to us, we are modifying it to our way. The instruments are actually the instruments are that there is a basic connection to the mallet. To the top, what do you give us? The top part instrument is in our hand, and the thing, other good thing is
Yeah.
cannot.
Very forgiving, by the way. It's very forgiving.
It's very forgiving. And there is, you know, that sometimes when you're doing a third molar disimpatry section, so many inner ears, so many times, oh, the soft tissue gets is brain. The visibility is very pure impervious. I do a lot of harvest say. Once I from the remes area, I usually once I buy it, I use the extraction the collector. Yeah, or the extraction connector, or I use for the extraction to take off, or I use the split to take off my now pieces off. So the bounce, so that yes, what did you say? So you have an instrument in fact. And while you start becoming confident, then you know how it application. And then is the application. You just be on this thing from to be honest, PS from last to so yes, a habit customer to a solid. And and it's just like a backup. The day mallet might stop working or something goes wrong with mallet, maybe that day I lip on my all the tapes, the whole ultrasonic is just mallet cutter.
So, bottom line, there's definitely something new out there to make implantology great again. We, implantology is great, we make it great again.
But yeah, but it's yeah, fun times on. I see a lot of promising good surgeons. I always and tell. I always tell to implantology if you want to be succeed. Safety is I don't see any and I don't see any whisper result gives a more safer result, a more predictable result.
Thank you very much for what you shared. Thank you so much, Dr. Kubar.